According to Bessel van der Kolk, the resultant trauma from child abuse is our world's single most important public health challenge that has the potential to largely be resolved by appropriate prevention and education. Like a lighthouse, we as clinicians and professionals working with children and their families have a responsibility to listen, to help, to believe, to identify, advocate, and heal the most vulnerable, our children, unborn babies at risk of abuse, and their protective parents, who themselves may also have experienced childhood maltreatment and may also still be at current risk in interpersonal violent relationships or domestic family violence. Many will remain in the dark, experiencing shame and fear, guilt and self-blame if they are not given a lighthouse in which to look to in these unbearable times. Now, I'm going to play this. I'm going to try and fast forward it slightly. He does swear at the beginning, so if I can't fast forward it, just forgive me. How do I play? The movie William Wallace from Braveheart. He's actually on his horse, he's riding in, imagine the army's there with him. He's rallying them to fight the battle for the people of Scotland. And he's saying, I am William Wallace, and I see a whole army of my countrymen here in defiance of tyranny. You've come to fight as free men and women, you are. What will you do without your freedom? Will you fight? And they say, against that? The afraid army said, no, we will run and we will live. Fight, William Wallace said, and you may die. Run, and you may live for at least a little while. And dying in your beds many years from now, would you be willing to trade all those days from this day to that for one chance? Just one chance to come back here and tell our enemies that they may take our lives, but they'll never take our freedom. Today, I've been really privileged to sit here and I see a whole army here amongst you of men and women in defiance of this tyranny against protecting the rights of a child. My name is Dr. Cher McGillivray. I'm a clinical psychologist, an assistant professor from Bond University. I'm also the head of our master's program and have the privilege of teaching the Masters of Clinical Professionals coming into Australia. However, as a researcher, upon researching the statistics, I have been horrified to see that child maltreatment and abuse is becoming increasingly worse each generation, not better. In Australia, we're one of the worst countries. We have increased from 1 in 4 children experiencing sexual abuse to 1 in 3, according to our Australian childhood maltreatment studies that came out last year. And these are at the hands of people that they love and trust, not stranger danger. Globally, 1 in 5 women and 1 in 7 men are experiencing sexual abuse still as children. And it was in my moment of choice as I face these children, not just as statistics, but as my children and children in my clinic, in my students, I had to decide, what would I do without my freedom? Would I fight like William Wallace for his freedom speech from Bravehearts? That each of us in our daily practice has to decide, will we fight or will we run away? Another one of my favourite quotes is from Legends of the Sword. What's the difference between a man and a king? We both want to look away. The difference is that a true king and leader chooses not to look away. And it's been a privilege again here to see today that none of you are looking away. You're all being the lighthouse. So it's been really encouraging. So secrecy and silence really surround child abuse within families because of the shame, the denial, not being able to be seen, and as you were saying, Martin, children not being able to communicate those disclosures, that many will experience their experiences very privately, resulting in a true scope of abuse remaining largely unrecognised outside the family context. It's really important that we as clinicians and professionals notice those unseen signs and symptoms, listen to the voice of the child, that we document what Alison was talking about today, the trauma symptoms, the pattern of behaviours, the somatic complaints, all of those things that are indicative of childhood trauma, and not just be diagnosing them with anxiety, but also noting again if it is indicative of childhood complex PTSD, which is the new diagnosis. I know in the ICD-11, it's not in the DSM-5 as yet, But those sort of diagnoses actually really help treating clinicians to actually look for trauma, to treat trauma, and it also helps support the evidence of a child. So a child who does make a disclosure, or there are no sort of verbal disclosures as yet, indicators of that pattern of complex trauma are really helpful to help support the evidence of a child's testimony. Abuse is really a misuse of power, whether it's physical, emotional, spiritual, or institutional, that harms, controls, or exploits another person, especially the most vulnerable. These forms of harm may look really different, all the different types of abuse. However, they all contain a common thread. They occur within relationships where a child depends on an adult for safety, care, and protection. The injury does not just come from the abusive act itself, but from the betrayal of trust and violation of safety within a relationship that should have nurtured them, but is now their feared person, as well as the person they love. Sorry, my slide's missing a lot here, so I'll just tell you what it said. It's basically saying that the biggest actual sexual abuse right now is actually the rise of online and non-contact sexual abuse. We are seeing a profound shift, really. It's happening in children's bedrooms. It's bypassing traditional safeguarding. We have recently received a grant at Bond University with Monash University. We are looking at developing trauma-informed protocols to help police actually contact victims of unknowing sexual abuse of online, of capping, to help them have a more trauma-informed approach to have those conversations with unknowing victims of sexual abuse. Prevalence: 1 million children globally have experienced childhood maltreatment, which is approximately half of all our children. We know that girls experience abuse at nearly twice the rate of boys. However, again, this is probably not accurate because of the lack of disclosures, stigma. We know that most disclosures, 85% of them who actually have the courage to go to police, 85% do not proceed to criminal proceedings. Many are retracted. Only 5 to 30% actually will report to police in the child family law system, in the criminal courts. I know in Australia, many children, because of the lack of evidence, are being sent back to perpetrators, making our children even more unsafe. This is some of the Australian statistics. Domestic violence is still really high as well. So it's almost 40% of children who are experiencing domestic and family violence. Emotional abuses are really important. Some of the research and papers we've been finding now is that it's actually emotional abuse that's maintaining the children's PTSD above and beyond sexual abuse and physical abuse. So emotional abuse is really important for us to identify through those conversations as well with children. Most abuse is within the family home or to people that they know, usually in love and trust. It is not stranger danger. So domestic and family violence. In Australia, there has been a recent law of coercive control. So coercive control is basically those patterns of intimidation, isolation, and monitoring, so that harm is even more profound when there is no disclosure or visible injuries. Domestic family violence, children are not just experiencing psychological abuse, they're not just witnesses. They are also experiencing somatic symptoms. Often you might see this: abdominal pain, headache, sleep disturbances, anxiety, hypervigilance, emotional dysregulation, school decline, absenteeism, parentification, being overly perfect in their behaviour. These are all red flags that require trauma-informed responses. Private normalised inquiry, like what Martin was saying, but just and really careful documentation, again, like what Alison was saying, recognising that that clinical support, the documentation, sharing it between professionals is really important, as that can help ultimately protect a child. We all know that research shows that individuals who are experiencing domestic and family violence often will not disclose this to practitioners, again, unless they are actually asked, or even net screen, and as you say, have those conversations. Otherwise, it will remain hidden. I wrote a poem once, and I might just read just the first stanza of this. These are what this was written for children who may never receive an apology from their abusers. Arise, unapologetic eyes. As a child, you learnt to speak in glances, to suffer in silence, or scream only at safe faces. Your eyes begged for someone to notice. Do you think something's wrong? What felt normal blurred the truth. They called it love, and so love became the enemy. Your secret hid behind a bodyguard of lies, the reason for your unapologetic eyes. And I think it's just about us, taking the time to hold space. If we see the signs and symptoms and something's just really not adding up, to look behind those eyes and really take the time to see what's going on in that child's world. So the other people really impacted by child abuse is the non-offending parents. This is where a lot of my work really comes in, because 1 hour of therapy a week with a child is not actually enough to help them. We need to be making sure that the parents who are suffering, usually from moral injury, blaming themselves because they didn't know their child was being abused and they thought they were protective parents. So we work with dealing with that moral injury, releasing them of that shame, pain, because my research shows that it's maintaining, again, PTSD by up to 47% above and beyond the traumatic event itself. So working with parents to help them work on their nervous systems as well, so that they really have that right brain to right brain emotional connection, being that safe place for their children so that their children can recover and speak openly with their parents. This is a new paper that's just come out that we've just produced. It's basically saying what I've already said, that moral injury is one of the strongest predictors of PTSD. So I think working with moral injury in parents and children who've been maltreated is really important. One of the other findings, most of the children who had experienced abuse, almost 50% of their parents had also experienced sexual abuse. However, they didn't find that as traumatic as knowing that their children had experienced abuse. So that's that one. Trauma. I think we've talked about that a lot today. I think the main takeaway point here is, as clinicians, parents, aunts, uncles, we just need to make children feel safe. We need to hold space for uncomfortable topics. One of my favourite quotes is that suffering really isn't caused by the pain of this world, but it's about our avoidance of it. So the more that we can hold space for pain, for suffering, and bring any shame into the light. Shame can't exist when we bring it into the light. So I think helping children do that is one of the gifts that we can give them. I've already spoken about this, but complex PTSD is really important for us as clinicians to be working on those things above and beyond PTSD, so the interpersonal difficulties, the negative self-concept, and that affect dysregulation. And again, I think documenting, if they do meet the signs and the criteria for complex trauma, it really is important to have that documented so that treating clinicians aren't going to misdiagnose them if it is from a trauma history. Okay, I won't go too much into trauma in the brain. I think you guys are probably more expert at this than me. But I just basically put this up just to remind you of the structural dissociation, that children won't remember everything necessarily, and with trauma, because of that splitting of the brain, so that we can go on with normal life self, the left-hand part of the brain, put sort of masks really, we get on with life, but the right-hand side of the brain is storing that trauma memory. So the more we can help children feel safe to even be able to recall the trauma memories, if we are sort of in that child protection space, is really important to not re-traumatize them so that they again can't speak, they can't communicate, and they feel unsafe. Yeah. So, yeah. One other thing I was just going to mention there, so seeing or hearing of their trauma causes a shattering of the world and helplessness. So make sure that we don't do that, I suppose, and we don't re-traumatize them when we see and hear of a child's trauma, because as soon as they feel safe, seen, heard, believed, as I said, that shame can no longer exist. Helping parents is what we do in our Parenting Beyond Trauma program. We help them learn about the brain and body biology so that they can live more in their parasympathetic nervous systems to help their children regulate. It's really important. Trauma recovery, post-traumatic growth is possible. Trauma recovery, I think working on their strengths, regulating, helping protective parents be that safe person. That top quote's really important. So while abusive relationships impair integrated brain regions, healthy relationships can downregulate the vagal system that promotes healthy restoration and safety for that child. So that's really important for parents, for teachers, for clinicians to understand that, so that we're not re-victimizing children and giving them secondary vicarious trauma again. This is another paper we put out for police, again, to have trauma-informed responses when working with children or victims of any sort of form of abuse. And essentially, it's about having compassion, containing, understanding the window of tolerance, and even how our voice tones, vocal tones, eye contact can again engage that parasympathetic nervous system, because they're going to be in their fight or flight, okay, people who've experienced trauma. So it's understanding that, giving them choice, as we've spoken already about today, and that connection. So really resounding themes there today. Again, parental involvement is really what leads to the best outcomes for a child, okay. These are just some of the results of our parenting program. We do run these parenting programs at Bond University. So what we find is that, again, parents knowing that they're not alone, they're not to blame, having that support group is really important. So we do run those online sort of twice a year. So if you ever have anyone that you'd like to refer to us, they're free, and we find the results, it actually reduces their PTSD, their complex trauma, increases their resilience, their self-compassion. One of the biggest factors that we've found, again, that causes that maintenance of PTSD in parents, they've got negative self-compassion. They can't show themselves any compassion because they're blaming themselves for what's happened to their children. So that's what we work on. Moral injury is one of the biggest factors, I think, again, that I've already discussed. I came across this in my PhD when I realised that it was actually the guilt and the shame, again, that was maintaining their PTSD, that I changed my whole PhD to really working on moral injury in parents of children who have experienced sexual abuse. We've developed 2 measures of moral injury so that we can actually assess for parents and children who have been through maltreatment, to measure their levels of interpersonal moral injury, their intrapersonal with relationship, because it's often in those relationships betrayal, and also institutional, because a lot of them who haven't been helped, unfortunately, by the system. So again, if we can name it, we can tame it, we can help them work through those areas of moral injury. So we've got that scale available now for parents and children. Just going to flick through these. There's 2 other scales, 3 actually, that we've also developed. One of them is a short form like the ACE, but it incorporates all of the forms of childhood maltreatment. So not only sexual abuse, physical, emotional, but all the somatic symptoms, the cognitions, the negative cognitions, whether they've witnessed domestic violence, child trafficking, and it has online abuse as well. So there's a short form of that. There's also a longer form if there's in, like, for child protection reasons, and there's ones for adults and for children. So essentially, my recommendations is that intergenerational trauma really does require early intervention from us. Requires us believing, supporting, and advocating for those without voices. I think moral injury, I've seen it firsthand be a real bridge of recovery lens for parents and children. Children often, when they're experiencing abusive relationships, will suppress their emotions, their thoughts and feelings, because they have a greater need to survive, because of the grooming. They'll often just go along with everything to keep everybody else happy. So it's really important that I think that we address that moral injury and acknowledge the limitations, not only developmentally of a child to communicate, but their greater need to survive, but we need to help them know their rights, to be safe, and to really be safe, really. Ongoing work to assist and identify, protect and help families. I mean, it really is in a state of awful human mess, but it has been really inspiring to see all the good work that you guys are all doing here. So I'm feeling very encouraged today. So in order to prevent or repair this type of betrayal will really require both dedication of us all, and courage. I think institutional courage, personal courage, empowering children to have courage, and being brave. I think just being that lighthouse in unbearable times, so that children and parents know that it's okay not to be okay, that they're not alone, they're not going to be judged, but they have hope for healing, so that children do, I think the future generations will grow up safe, and have the opportunity to just not be safe at Maslow's basic hierarchy of needs, but to progress in their relationships, fulfill their purposes in their life as well. So thank you very much.